Good afternoon and welcome to Staying Safe with Epilepsy All Summer Long. My name is Andrea Rassiopi and I'm Vice President for Epilepsy Services of New Jersey and the Family Resource Network. I will be your moderator and webinar organizer for today's session. This is part of a month of Services of New Jersey, but it's a little bit different. Webinar series that we're doing at different. This month we're partnering with our national organization, Epilepsy Alliance America, and we're on this very important topic that really transcends all different states. It's not a local issue. I would like to introduce everybody that will be helping me with today's webinar. We have Dr. Nicole Hartman. She's an epileptologist with Capitol Health Institute for Neurosciences. Michael Pearson, who is our camp director and with Epilepsy Services of New Jersey, and Cassie Corral from Epilepsy Alliance America. Just so you all know, that today's webinar is not going to be seizure recognition and response training. We're just talking about tips and different things that we might want to be on alert for when we with the diagnosis of epilepsy in the summer. If you'd like to view our seizure recognition and first aid response training, you can go to our Epilepsy Alliance America website. The website is listed on screen, and I'll put it in the chat at the end of the webinar as well. So some objectives for today's webinar will be how summer heat, sleep changes, and activity can affect seizure risk, summer camp tips, best practices for hydration, sun exposure, and medication management, swimming and outdoor safety tips for individuals with epilepsy, seizure first aid, general seizure first aid with water safety, and resources to help you prepare and stay safe all summer long. So just logistics before we go on with the rest of the webinar. For those of you that are joining us as attendees, there's an orange arrow to open and hide your control panel. To listen to the webinar, you have two audio options to choose from, mic and speakers, and telephone. If you can't hear well using your computer speakers, you can elect to use your telephone to listen to today's session. In order to maintain the best sound quality possible, all but the presenter will be muted throughout the webinar. If you have any questions or comments, you can submit them using the questions panel. That's in the drop-down menu with the orange arrow, and we'll be able to pose them at the end of the webinar to the attendee that the question is for. Just wanted to highlight some common seizure triggers that happen all year round, but we want to take special attention to in the summer. So these seizure triggers are dehydration, heat exhaustion, and irregular sleep, and medication timing. So these are all things that we face as, some might face as seizure triggers throughout the year, but we want to pay special attention to some of this during the summer months. So now let's talk about some specific summer safety tips. Hydration and heat protection. High temperatures and dehydration and sun exposure can increase the risk of seizures in people with epilepsy, especially during the summer activities like sports activities, outdoor events, picnics, or camp. So it's important to protect the person from heat-related seizure triggers. So let's talk a little bit about hydration. Hydration, you want to make sure that you drink water regularly, even before feeling even thirsty. Use electrolyte drinks like Pedialyte, Gatorade on hot or active days. It might be good to avoid caffeine, alcohol, and energy drinks. They can dehydrate you. Next tip would be clothing and gear. You want to wear light, breathable clothing and even light in color as well. A wide-brimmed hat, UV blocking sunglasses. You want to avoid the biggest time during the heat during the day, which is 12 to 2. And there's also something called a cooling vest that one of our partner organizations Josh provides will help assistance with financially. So cooling vest is just what it sounds like. It's a vest that's put on and it helps cool your body during those hot times. Shade and cool zones is an important part as well. Obviously, if you have the option to be indoors on a very hot day, today in the Northeast, it is extremely hot, but hopefully it'll break. And it's nice to be inside in air conditioning. Avoid direct sun between 11 and 3, and use cooling towels, misting bottles, or fans. You also want to plan your activity, so you don't want to go out in the middle of the day and do the activity. You want to schedule outdoor activities in the early morning or in the evening as the sun's going down, or even after the sun has gone down. You want to frequently rest and make sure that you are not having any signs of dizziness, nausea, or excessive sweating. It's really important to recognize heat stroke symptoms. So you want to watch for flushed skin, high temperature, or lack of sweat. The next thing that we want to talk about is travel. So travel is something that a lot of us do more of in the summer months because school's out, or maybe we save some of our vacation days for the nicer months. So there's important things that we want to keep in mind as far as regulating our epilepsy. We want to make sure that we manage time zone changes. So you want to, if you're traveling abroad or if you're even traveling across country, you want to make sure that you take the time change into consideration when you're taking your medication. Irregular sleep. It's important to make sure that we're sleeping like the non-summer months and making sure that we're keeping track and getting a good night's sleep. For flying, we want to plan ahead. We want to make sure that we visit our neurologist before a flight if our seizures are in control. We want to bring medication and keep the medication in your carry-on, not your checked luggage. Bring an extra dose of the case in case of delays. You want to make sure also if you have any rescue medication to have that on you as well, on your carry-on, on your body. Airport security, you can bring pills and liquid medication through security. You want to declare them. Wear a medical ID bracelet to carry a card stating your condition. During your flight, you want to make sure that the medication, you're taking your medication on schedule, and as I mentioned earlier, taking into consideration the time zones. So an interesting question that we got prior to this webinar is about amusement parks. So amusement parks, big part of amusement park is our actually roller coasters. So roller coasters, if you have a photosensitive epilepsy trigger, roller coasters can have flashing lights, strobe effects, or bright contrasting visuals, especially the indoor or themed parks. So you want to make sure that you take that into consideration. If you have reflex epilepsy, some individuals may be triggered by the sudden emotional stress, excitement, or rapid movement. Stress or anxiety or adrenaline spikes may lower the seizure threshold for some individuals. You want to consider safety risks during the seizure on the ride. So high speeds, turns, drops. Just know your body and know your epilepsy and take precautions. Warnings and restrictions, when you're waiting online for that amusement park ride, there's always some type of sign that's up, do not ride if you have, epilepsy or if you're pregnant. So take that into consideration. These are usually liability precautions, but also reflect legitimate health concerns. So through EAA, we have a seizure ID program. Individuals with epilepsy are eligible to receive a $35 coupon to be used at www.getmyid.com, where you can purchase a seizure ID wristband or another product of your choice. So I'll just wait a second, you can jot that down. That's another way to make sure that individuals know that you have a diagnosis of epilepsy. We talked about medication a little bit. So obviously that's a picture of Valtoco, which is a rescue medication. And we want to also make sure that we know how our medication should be stored. In the hot summer months, you want to make sure that your medication is some of your medications, if they need to be, are in a cooler, or making sure that the temperature is regulated. Sunlight and photosensitivity. So photosensitive epilepsy is a condition where seizures are triggered by visual stimuli. It doesn't have to be something as obvious as a strobe light. It could be flashing lights, rapidly changing or contrasting light patterns. It can be if you're in your car and there's the light coming in through the trees every now and then, and flickering. So fireworks are also one of those intense flashes that could actually pose a serious risk for individuals with photosensitive epilepsy. So sunglasses, hats, those are all ways to be mindful of the sunlight in the summer. So let's talk a little bit more about fireworks. So triggers in fireworks. So why is it a trigger? So there's bright flashes and rapid flickering, high contrast against the night sky, sudden light bursts are especially in sequencing. So some colors may also be more provocative, red and blue. Some precautions if you have photosensitive epilepsy and you plan to see some fireworks. Avoidance, stay indoors or away from events when fireworks are expected. Protective eyewear, a use of a screen, or companions. Be with someone who knows what to do in case you have a seizure. Event organizers might offer fireworks-free zones, provide warnings, choose a low flash, quiet fireworks if inclusivity is a goal. The organizers might also inform attendees in advance if there's strobe effects. So just be aware if you are going to a situation where there might be fireworks and you are susceptible to photosensitive epilepsy. So swimming and water safety. Swimming is a huge fun part of the summer, at least in the northern part of the country where it's not hot as many months as in the south. But swimming and water safety, there's a risk of drowning is 15 to 19 times higher for people with epilepsy. People with epilepsy can swim, obviously, but there has to be some precautions, and we'll talk about that in a bit. Most frequent epilepsy-related cause of death after SUDEP. Epilepsy is the third most common cause of deaths occurring in the bathtub. Epilepsy is the only medical condition associated with increased drowning risk among children aged 0 to 14. So why is it risky to be near water with epilepsy? There's a couple of reasons, right? So a seizure in water, even a brief one, can cause loss of consciousness, disorientation, or muscle control that can lead to silent drowning. Drowning can even occur in shallow water, including bathtubs or showers. So what's some core water safety rules for epilepsy? So bathing. You want to avoid baths. You want to take showers instead. Use a shower chair and a handheld shower head. Leave the bathroom door unlocked or shower with somebody nearby. Consider a seizure monitor outside the shower. Swimming. Never swim alone. I mean, that's good advice for anyone. Wear a life vest, especially in open water. Avoid diving deep ends. For boating and water sports, always wear a life vest. And before water activities, it's really important to take all your medications on time. Also avoid alcohol, overexertion, or anything that could be a seizure trigger for you. Might it be safer for you to go swimming? You may participate in more activities with caution if you've been seizure-free for over a year, your seizures are predictable, or you've discussed the activity with your neurologist. So what do you actually do if somebody does have a seizure in the water? Do not attempt to remove the person while they are actively seizing. Support the individual's head and airway while keeping them above the water. Once the seizure has subsided, the individual can then be safely and carefully removed from the water. Follow the person's seizure action plan. These are predetermined steps or directions on how to help an specific individual. All those forms can be found on our Epilepsy Alliance America website. and call 911. Seizures in waters are always a medical emergency due to potential for aspiration. As I mentioned earlier, we actually have a lot of tools at ESNJ and through our national organization, EAA. These are trust trainings. These help you to know what to do in case somebody has a generalized tonic-clonic seizure. They're available on our websites. And if you would like to know more about seizure recognition and response, please view our on-demand training online. At this point, I want to welcome Michael Pearson to talk a little bit more about CAMP. He's director of our Camp Nova in New Jersey and has been for a couple of years, so he has a lot of experience with this.
Thanks, Andrea. So attending summer camp can be a rewarding and fun experience for children and teens or even adults with epilepsy, but it really requires planning, clear communication, and choosing the right camp environment. And with proper precautions, many kids, teens with epilepsy thrive at camp alongside their peers. So having epilepsy should not be a barrier for a youth to be attending camp and enjoying the opportunities that go along with camp, like new recreation opportunities or social engagements. But it's really all about a few things. Choosing the right camp is very important. So there's a few different options that are out there that are available. There's inclusive mainstream camps that have additional trained health professionals on site to provide health support. There's specialized medical camps that are epilepsy focused or have a focus on serving chronic conditions or individuals with intellectual and developmental disabilities. There's also high adventure camps, which might need a little extra screening on the family's part to make sure that it's a safe environment for their child with epilepsy. So that could be camps that have a specific focus on swimming, climbing, horseback riding camps, things like that. There's also medical preparedness to think about. So, when you're looking for different options for camp, look for camps that have a full-time nurse or medical staff available. For example, Camp Nova, which is Epilepsy Services of New Jersey's camp, we have 2 nurses on site that are available 24/7 during the week of camp. They respond to basic camp injuries like scrapes and bruises, but they also respond out at activities or in campers' bunks to seizures. So that kind of brings to the next point of make sure that the medical staff and camp counselors and administrative camp staff have experience working with campers who have epilepsy or other seizure disorders. And then also, it's a requirement by a lot of states, including New Jersey, but there should always be clear emergency protocols in place and access to emergency medical services as well. In New Jersey, for example, we are required to contact the local hospital, local emergency rescue squad, and another healthcare provider in advance and have letters from them saying, okay, we're aware that your camp is going to be on this site, that there will be individuals who have epilepsy there, and we are ready to provide emergency medical services. So there should always be an emergency protocol in place. And then when you're kind of scouting camps, don't be afraid to ask questions. As a parent, especially if your child is really young, it's really important that you are an advocate for them when selecting a camp. As kids get older, it's definitely appropriate for them to ask some questions, but some of the things you want to ask are about the staff training, right? You want to ask camps how they're training their staff on seizure first aid. I will shamelessly brag about Camp Nova that everyone at Camp Nova, from camp nurses to counselors to just administrative staff, have received trust seizure recognition and response training. So every single person at camp is trained in seizure first aid. You can ask how staff are trained in administering rescue meds. Are they administered only by nurses? Are they administered by counselors? And you can ask about specific rescue meds as well. If you discover that, the camp medical team that you're working with isn't as familiar with these rescue medications, have an open conversation with them about it. See if there's anything that they can do to get trained or become more familiar with these things. And then you can also ask about procedures during a seizure. It kind of goes hand in hand with having a seizure action plan that you're submitting to the camp that tells them, okay, if a seizure is lasting longer than 3 minutes, you need to be calling 911, or specific things to expect when a camper has a seizure. And then thinking about the local clinics or hospitals nearby, that kind of goes along with the emergency protocols and access to emergency medical services. But it's something you always want to think about. And as a parent, it's your right to ask these questions to make sure that the camp that you're selecting is the appropriate environment, both from a social and recreational standpoint, but also to make sure that it's a safe environment. So jumping to the next slide, talking a little bit more about summer camp safety. We know that going to camp means that campers are going to be engaging in activities that could potentially be triggers for seizures, or could be a situation where we need to be a little bit more vigilant about the potential for seizure. So obviously the number one is swimming. So Andrea talked a little bit earlier about, never swimming alone, making sure that you're working with someone, whether it's a counselor or another staff member, having that one-to-one supervision, wearing a life vest, and then making sure that the lifeguard is informed that the person swimming does have epilepsy, and to keep a little bit of an additional focus to make sure that they are safe. So bathing and showering too, using a shower chair, making sure that the bathroom door is open or unlocked, and then having that buddy system. I will always go back to our examples of Camp Nova. Anytime that a camper who has a seizure, or anytime a camper who has epilepsy is showering, we make sure that their counselor is right there for them. Then there's hiking and outdoor activities. These are examples of times where people could be experiencing seizures, or an increased likelihood of it, right? If people are out hiking, doing outdoor activities, extensive exposure to heat, dehydration are all possibilities for a seizure. So making sure that campers are staying hydrated, cool, well rested, and avoiding overexertion, or hiking alone as well are things we want to make sure we're being aware of. Then there's the sleep aspect of it too. Camp is a time where a lot of times people are experiencing a little bit of sleep deprivation. It could be because they are, the days are jam-packed with activities, so they might not be taking a nap during the day if they otherwise would, or they're staying up later than usual because they're hanging out with the other campers and having fun. So monitoring sleep schedules, and then being aware of any seizures that occur during sleep are very important. And then the last thing is seizure medication. So being upfront with the camp medical staff, letting them know about either daily medication that needs to be taken, when it needs to be taken, what doses, and like I said, what times, but then also, like we mentioned earlier, making sure that the staff is educated on rescue medications. So when you're selecting a camp, talk to them about any medical history. You can give a detailed seizure history. We highly recommend using the Seizure Action Plan form that was developed by Epilepsy Alliance of America. That includes things like frequency, triggers, recovery time, medication schedule, what seizures look like, what to do and what not to do when your child's experiencing a seizure. And then obviously having those triggers on there as well. If you know that excessive heat or lack of sleep is a trigger for a seizure, communicate that to the staff and make sure that they're aware and they can try to avoid those things. And then also making sure that you're including the step-by-step guide for how to respond. A lot of camp counselors might be college kids or people that are just having a summer job. So as much information as you can give them to inform them about how to respond, and how to best support a camper with epilepsy, that's always best practice. Make sure that you've given them a list of contact information that could include your number, another emergency contact number. You could include the neurologist or physician's contact information, include insurance information as well, and then they'll probably have a signed permission slip that you'll need, just to make sure that if there are ever any medical emergencies, that they can provide whatever treatment that they need to. So just a couple tips to close there about camp. Make sure that campers are staying hydrated and well rested. Make sure that they're using sun protection and staying out of the heat if it's ridiculously hot the way it is this week. Using the buddy system when swimming, hiking, or bathing, and then making sure that we're staying consistent with medication schedule. Adjusting those medication schedules are obviously a trigger for seizures, so making sure that you're clear with staff that medication needs to be taken at a specific time every day. So just to wrap up, having epilepsy should absolutely not be a barrier to kids experiencing an awesome summer at camp, getting those recreational opportunities and getting those social opportunities.
Thank you so much, Michael. You actually read my mind. That's what I was going to say right after you wrapped up. Every time I do a seizure recognition and response training and we talk about our Camp Nova, the big thing that I say is Camp Nova is a regular camp. We do normal things. We swim in the lake, we rock climb, we have a zip line. But you just need to take some precautions, right? Everyone should take precautions in life, but it is important to make sure that people with epilepsy aren't kept from doing all these things at camp. Thank you so much, Michael. I really appreciate it. And I hope, I'm praying that our week of camp is not like this weather outside right now.
Yes.
So at this point, I just want to throw the presentation over to Cassie from Epilepsy Alliance America. She's going to share some information for those of you that are on the call from different parts of the nation. We have partner organizations all throughout the United States that offer different activities in the summer or swim activities. So at this point, I'd like to introduce Cassie.
Thank you so much, Michael and Andrea. Yes, I just wanted to be able to share some of the resources that are available both on Epilepsy Alliance America's website, as well as highlighting some of the programs that our member organizations in different locations are offering for their constituents that are around the idea of water safety or summer activities. Next slide, please. So one of the first ones that we're going to talk about is through Epilepsy Alliance of West Central New York, which is part of Empowering People's Independence. They are located in upstate New York, and they offer a Learn to Swim program. And one of the things that I think can be applied to everyone, I'm also the parent of a child with epilepsy, so I understand that there can often be a lot of fear around the idea of letting children with epilepsy near water. The concerns about potential for drowning or having seizures in the water is very real and very valid. So even more important that we are supporting those children by giving them safe and safe water instruction and making them feel comfortable in the water, because we want them to feel comfortable in the water and know how to stay safe. And one of the most important things that they do as part of this Learn to Swim program is make sure that every child in their program is supported with a one-on-one support. So every child has a volunteer that is assigned just to that student to make sure they're safe in the water. They have an epileptologist who stays on deck the entire time that the kids are in the pool, learning to swim. Just in case of an emergency, there's someone there to respond right away. All lessons are run by a certified swimming instructor, and the kids really enjoy it. This program has really grown for them over the years and has become one of their, they say, one of their favorite programs, and that families look forward to it, and it really provides these children with ways of becoming comfortable in the water and knowing how to stay safe. Valley Children's Healthcare is an epilepsy support program located within a children's hospital. They are one of our West Coast member organizations out in California, and they really provide a water safety day that can be applied to not only children with epilepsy, but just provides information about how everyone can stay safe around water. They can still have fun enjoying water, swimming in different water activities, but also focused on drowning prevention and safety tips for at home with your pool or near any body of water. Sail for Epilepsy is a wonderful and unique organization that is, you can see in the upper right-hand photo there with the red hat. His name is Phil. He lives with epilepsy and has really turned it into a wonderful opportunity to pursue something that he loves, which is sailing. And he sails around to all different locations and brings epilepsy awareness events to the different locations that he sails to. He talks about not only sailing, but just about not letting epilepsy hold you back. So as we have kind of throughout this webinar talked about different risks, which are very real and something that we all need to be aware of, we also want to make sure that we are letting everyone know that we still encourage people with epilepsy to pursue activities that bring them joy, pursue activities that help them stay healthy, just doing it with some safety practices in place in order to make those activities the safest that they can possibly be. So we have a few photos here of activities that were done in coordination with some of our member organizations. We have two of our Florida organizations represented here, as well as Epilepsy Alliance Louisiana. Phil was able to visit these locations and bring some of his encouragement to other people to take one more step into doing different things that challenge them and bring them joy while doing it in safe ways. And then I know we've mentioned a couple different times, would love to point you towards Epilepsy Alliance America's website. We do have a lot of different resources on there. This flyer that you see featured here was actually a collaboration between Epilepsy Services New Jersey and Valley Children's Healthcare, which I mentioned just a few slides ago, to just provide some tips for seizure water safety. This is available for free and for download on our website in both English and Spanish. This is actually Epilepsy Services New Jersey's event, so I will let them talk a little bit more about it, but do want to bring attention to the fact that they have a couple of really great events, starting with their Seize the Wave event, I'm so sorry, that encourages people to get in the water with professional surfers and learn how to do a little surfing, again, with that one-on-one support and keeping them safe, as well as their Day at the Beach event, allowing people to enjoy a day at the beach in safe ways that are monitored with lifeguards and other safety precautions in place as well.
Thank you so much, Cassie. So
thank you.
Yes, these are some of our events that we have in New Jersey as far as in the summer months. We're still waiting on a date for the Day at the Beach at the Governor's Beach House. And if you're interested in either of these activities, please feel free to reach out. So I'd just like to give some more information about Epilepsy Services of New Jersey and some programs that we have. So as I mentioned earlier, this is part of a monthly webinar series that we're doing in 2025. On Wednesday, July 30th, we're holding a webinar at 12 o'clock on epilepsy diets. And on Monday, August 25th, at noon as well, navigating pediatric mental health. All the past webinars are available on Epilepsy Alliance America's YouTube channel and our webinar hub. And I'll make sure that everybody gets all these links in a follow-up email as well. So just some summer aside, some programs that we have at Epilepsy Services of New Jersey consistently throughout the year. This is our patient assistance program. And there's also a link on our website as well. If at any point you want to talk to one of our staff about non-medical issues, you can scan that QR code or visit our website or call the 800 number, and you can set up an appointment with one of our staff to ask any questions that you might have, maybe concerning school services, housing, anything non-medical, we can definitely assist you with. We also have the program with my Spanish-speaking colleague. So if there's a Spanish-speaking person, we will be able to assist that person as well. We have a health insurance navigator program. So if you need help finding health insurance, please reach out to us at 800-355-0271. Some upcoming events that we have at Epilepsy Services of New Jersey. Our Day at the Beach, as I mentioned, we're still waiting on a date for that, and that's at Island Beach State Park at the Governor's Beach House. And we have our 49th annual Golf Classic. That's on July 14th in Clifton. We have our Seize the Wave event, as we just spoke about earlier. That's July 22nd, and that's in partnership with Paul's Purple Warriors, and that's in Seattle City. An event, I know it's way off, but our Paint the Pony Purple is a wonderful event that we do every year at the Stone Pony in Asbury Park. Here's the information about Epilepsy Services New Jersey. I'll leave it on for a couple seconds, and you can jot down our social media handle, our website, and also our email address. That was our staff at our holiday party, as you can see, with all the red and festive hats. And here's the information about Epilepsy Alliance America. So if you're not in the tri-state area and you'd like to find out more about what Epilepsy Alliance America partner organization is in your area, feel free to reach out to Epilepsy Alliance America or visit the website and see which partner organization is closest to you. So right now, we're actually all going to come back and show our screens. And now we get to get the medical expert, Nicole Hartman, to give some information about the presentation and also answer any questions that you might have. So please, if anybody has any questions, please type them into the toolbar and let me know if you, and I'll be able to pose them to Nicole. So Nicole, I actually did get one question so far, and let me just jot that down. Let me just look at that. It's a question about flying. So the question is, are you more likely to have a seizure when traveling by airplane? Does elevation make it more of a risk? Will medication work differently in the air like alcohol does?
Got it. Hi, everybody. Just introduce myself briefly. I'm Nicole Hartman. I'm an epileptologist through Capitol Health Institute of Neurosciences. I practice in Mercer County, mostly see patients in Lawrenceville and Princeton. But that's a great question, actually one that I field not infrequently. So the short answer to both of those questions is no. So there is not typically, going on a plane doesn't really give you any inherent increased seizure risk. Typically the reason that we may run into issues on airplanes or with travel is like a lot of the things that Andrea and Michael and Cassie all mentioned are related to time change, medication misses, or sleep deprivation. Those are definitely the things that I run into the most when patients are having breakthrough seizures when they're on vacation. And you're absolutely right, you should definitely bring your rescue medication with you. I would not anticipate it to work any different than when you're on an airplane as to when you're on the ground, okay? So definitely bring those with you. And yes, have them with you just in case of a seizure on an airplane. Is it okay if I just comment on a few things? I kind of
I was just going to say, I'm sure you took some notes during the presentation, so go ahead and give your medical professional advice on everything that we spoke about, please.
And so I love these kinds of conversations. They're actually my favorite conversations to have, and I have them all the time. Number one is make sure you talk with your neurologist specifically. I think my favorite thing that you said, Andrea, is know your epilepsy, right? Because I think there's not one set answer to all of these questions or concerns depending on the person. So one of my catch-all phrases that I say to patients is, if you're going to do something, take a second to think, what would happen if I have a seizure? If I would get gravely injured, maybe don't do that thing. So just take a second and think about like what would be the consequences if you were to have a seizure. Now, if you're well controlled and you haven't had a seizure in a long time, just make sure you're doing all the safety things like getting enough sleep. So I think sleep deprivation and time changes with missed doses are the most common reasons that I see breakthrough seizures. again, talk with your physician and make sure that this works for you. But what I typically tell patients is to start to change your medication dosing when you're traveling, if it's going to be a big time difference, usually by about 2-hour intervals. Now, some people can be a bit more sensitive and need their medication more exact on time. So again, just know yourself, know your medication, and you can always talk with your physician. But I usually say start to gradually kind of change it to make it convenient so you're not waking yourself up in the middle of the night to take your medication, because that's also not great either. Also think about where you're traveling. So that's the other thing too. If you're going to a place with low resources, what would happen if you need a hospital, if you're not able to access medical care quickly? That's something else to keep in mind when you're traveling. If you're in a place that is really limited and you have limited access to medical help, whether it's climbing a mountain or, you know, traveling to a place that has less resources. So those are just things to keep in mind when you're traveling. And also I usually recommend people not to travel alone in case you were to have a seizure. So someone can be there to administer this safety medication with you. Again, I agree. I mean, I absolutely agree with the carry-on. Make sure that you keep all of your medicine on your person. So in case your bag gets lost for whatever reason, and I absolutely always bring, even for myself, I bring at least 2 days of extra medication, just in case travel mishaps happen, you're not running out of a medication, or you're not stuck in a place where your prescriber can't send you medication, okay? And then ID, I love the ID. So if you have an ID bracelet that tells you, it tells people if you were happen to be alone or unsupervised, if you have epilepsy and someone were to come across you, they'd be able to, you know what's going on. Talk about time change, roller coasters. So again, for people that are well controlled, if you're not photosensitive, because absolutely not everyone with epilepsy has photosensitivity. So again, know your epilepsy. If you're well controlled and you know that things on roller coasters are not going to trigger you, go ahead. But of course, just think about it beforehand, okay? And make sure you talk about it with your neurologist. Make sure that's the right course for you. And so that's my thing about roller coasters. I agree. I try not to limit anybody as much as humanly possible. I think I want everyone to have the best summer and the most fun that they can have on vacations, while also being safe and within reason. Definitely have always a risk benefit discussion. There's actually one patient of mine that I have cleared to scuba dive. It is a very special circumstance. It's probably not something I would do broadly, but again, it's a case-by-case basis. And again, knowing your epilepsy and keeping an open communication with your doctor are the way to go.
So Nicole, Dr. Hartman was actually a camp counselor at our Camp Nova for a couple of years. So any feedback you want to give back regarding camp, being a counselor at one point?
Absolutely. So I love Camp Nova. It has a special place in my heart, and it's such a wonderful organization that, kids and that maybe aren't able to go, on typical camping trips, that they get that experience. And that's just huge to me. And, like I said before, I want everyone to have a fun and a safe summer and, to do all the things you need to do, but also while being safe at the same time. And so I think Camp Nova offers a very unique experience to allow people with epilepsy and even other developmental disabilities to get that experience. That is, I think, so vital to, growing up in the summertime.
Wonderful. Again, if you have any questions, please type them into the question section of your toolbar. This webinar is being recorded, so it will be uploaded on both the EAA website and Epilepsy Services New Jersey website. So thank you for sharing, Cassie, that you are a mother of a child with epilepsy. Is there anything non-professionally that you would like to share with the audience today?
Well, I agree with what Dr. Hartman said. It is kind of always trying to find that balance of, you want to make sure that they're able to enjoy all the activities, but you also want to take into consideration any potential risks and how to mitigate those risks. So for all the parents that are kind of trying to walk that tightrope, I sympathize with you. I understand that struggle. And then I did just want to, we briefly touched on the medical ID bracelets. It is something that I would really recommend, especially I have a teenager now. So, as they kind of get to that age where they're trying to have a little bit more independence, that's also the struggle with being a parent. You want them to be able to have some independence and also still not be worried about their safety. And that is really one way that can help give you a little bit of peace of mind. It is really accessible information for everybody. They have QR codes on them so that you can put whatever information that you feel is necessary for them to be able to stay safe, including emergency contact information, even their medication information, or how to contact their doctor. and seizure first aid steps so that anyone could access that information if needed, if they have a seizure in public. So I just would say to you know, take the preventative measures that you are able to take in order to kind of mitigate some of those risks and still allow your child, whatever age they are, to still be able to enjoy the things about summer and the activities that they enjoy participating in. And I think there's been so many wonderful tips shared here today. So I'm thankful for all of you for sharing this more broadly with everybody.
Thank you so much, Cassie. I'm sorry, I'm managing the questions as well. Let's see.
One thing while you're looking, Andrea, a lot of camps and places with formal organization, like whether it's summer camp, summer school, things like that, often have paperwork for things like this. So things like seizure action plans, which again, I sign them all the time. So that is definitely something your epileptologist, your neurologist should be very comfortable with. So, you know, don't hesitate to ask if they would like something formal in writing for a seizure action plan, just in case. And it often includes things like when to hospitalize, when not to hospitalize, and when to give the rescue medication. So I think those are very vital. And again, Epilepsy Services in New Jersey have a template that I sign all the time, and for seizure action plans.
Great. Dr. Hartman, yes, the next question is for you. And it is it safe and legal to travel with CBD oil? It's THC free. Obviously, this is a state question. This person's from California.
Is it if it's, so I'll go, okay, so let me take two parts of this. I may not be able to answer it 100%.
Yeah, absolutely.
I would say if it's a prescribed medication like Epidiolex or cannabidiol, which is, you know, FDA approved for Lennox-Gastaut syndrome, Dravet syndrome, that I would just make sure you have it in the container in which it is prescribed. So make sure that it's in the bottle that is prescribed. If you may or may not need a note from your doctor if you're traveling across state lines or country lines. So that is going to be very, very state dependent. And also as far as CBD oil that is not prescribed by a doctor or maybe got, you know, through a dispensary, which is legal in a lot of states in the country, including New Jersey, that I'm not so sure about, because even across lines into Pennsylvania, we run into issues with legality. So I don't know how to best answer that question. I think it's prescription. Make sure you have all the documentation. If it's not, then you will probably need to know the state requirements of what is going to be needed, either documentation or like if you have a medical marijuana card, make sure that's something you have on you, or what the states and countries' laws are regarding CBD oil.
Yeah, so there was a follow-up comment, no prescription because insurance could not cover. So
I know, such an issue we run into all the time. So frustrating for all of us, especially doctors and patients. But yes, if it's not prescribed, I would say you need to know the state's law that you're traveling to. And if you are traveling, I would say have your documentation with you with the CBD, usually medical marijuana card. That's what I would recommend.
yeah, so that seems to be, I think everybody did a great job of covering all the information. Maybe we can just I just want to make sure that I repeat again that Dr. Nicole Hartman is with Capitol Health Institute for Neurosciences. So I just want to make sure that everybody is aware of that. She's a wonderful asset in our state and even in the tri-state area as an epileptologist. So we want to thank her for her time today. Maybe we can just go around and everybody can just give some last words for this webinar. I think I will just say that please keep in mind everything we talked